Hi, I'm Jennifer Mapalid, and I'm at the Body Temple Pilates studio in Indianapolis, Indiana, and I'm here with my teacher, Mel Mendoza, and we are talking again about SI joint pain. Again, we are talking about the pain that may be radiating to one side of your lower hip or lower back, possibly in your glute and around your hip on the front side as well. This can be caused from instability in the hips, instability in the lumbar spine, possibly walking through one side more than the other. Maybe you cross your legs a lot. We can alleviate that pain by simple exercises and thinking about where we're at in space. So if you have a magic ring at home, this is a great way to do this. So I'm gonna put the magic ring with the pads on the outside of her knees, kind of like a halo over her knees. She has her feet hip distance apart, and she has her arms separated out to a T. So what I want to think here is that we're going to widen that ring from her width of her hips or her side bolts and not be widening so much from the knees themselves, okay? So we're gonna start with a bilateral or both sides, pressing out into the ring. So I'm gonna cue her to inhale, widen into the ring, and then exhale, slowly let that ring release. So you don't ever wanna let that ring completely release off because that's gonna be a popping. So we wanna keep activated through. And then one more like this. And then we're gonna go one side at a time. So she's gonna keep her right leg stable as she widens through her left. And exhale, return back. And then the right side widens and returns back home. Good. Then the left. Then keeping the left stable, right leg opens. And then we always want to end with a bilateral movement, so both at the same time. Then this last one we're going to hold. We're going to progress this movement, keeping the width of the ring. I'm going to have Mel pelvic tilt back, rolling to the back of her waist, scooping, trying to keep the width of the knees, and that's not as easy as it may sound, and then rolling back through. So what we're doing is we're causing the pelvic girdle to kind of open a little bit from behind by that pressure, so allowing that spinal column to move through, which should give you a little bit sense of relief from pain. One more time. And a full breath to come back. Beautiful. And go ahead and release your ring. Good. And that is the way we can work that little movement at home.